Zoom with the leading governors in the country, 5 Republicans, 5 Democrats. We've talked extensively about the need to cooperate and get the vaccine into places where you can actually get vaccinated, and their ideas of who they think should go first. I think we should be focusing on, obviously, the docs, the nurses, those people who are the first responders. I think we should also be focusing on being able to open schools as rapidly as we can. I think it can be done safely. So there's a lot to work out in the next 2 months as to exactly how it will be distributed. Now, maybe the hope is we can actually begin to distribute it. This administration can begin to distribute it before we are sworn in and take office.
The transition to Joe Biden's administration has officially been underway for just over 24 hours, and the biggest emergency his team will need to tackle on day one is the coronavirus and the deployment of a coronavirus vaccine. There are, as of today, another 166,000 people who've been tested positive in the U.S. More than 88,000 people are hospitalized right now with the disease. That is the 15th consecutive day that we have hit a record in hospitalizations. And most disturbingly, today, a benchmark, an awful one. 2,000 people, more than 2,000 people died of the virus just today. The need to roll out a vaccine quickly and efficiently is obviously urgent. It's a very complicated logistical undertaking that awaits the new administration on its very first day and its very first hours in office. That's why the president-elect formed a coronavirus advisory board. On that board is Dr. Rick Bright. He served as director of Biomedical Advanced Research and Development Authority and filed a whistleblower complaint in May, alleging the Trump administration ignored warnings about the pandemic, and he joins me now. Dr. Bright, it's great to have you on. You know, this is an area I think you have some expertise and technical assistance on. Can you just talk us through the logistics of this as an undertaking? How foreign is it to the U.S. government, or how familiar is it given what we do with things like the flu vaccine?
Chris, thanks for having me on. That's a really good question. It is probably the most complex, most complicated vaccine administration or immunization program than we've ever even contemplated in the United States or actually around the world. Never before have we tried to vaccinate or plan to vaccinate so many people as quickly and efficiently, and really importantly, equitably as possible. We know we're not going to have many doses of vaccine at the start, so we're going to have to really carefully identify and prioritize who gets those first doses of vaccine. We know we're going to have multiple types of vaccines with different schedules and different containment requirements, such as super low cold freezers, one is not so cold freezers, and refrigerators. So different logistics, 2 doses, one of them 3 weeks apart, one 4 weeks apart, and maybe even a single dose vaccine coming out in January, February. So there's a lot of complicated factors. A lot of things can go wrong, and that's why we're working really hard in the Biden transition team to make sure that we have a plan in place for day one, and we're trying our best to align it with the current Trump administration's plan to make sure that we don't miss the ball whenever the baton's passed to us.
Yeah, this does seem the one place. I mean, obviously, there's a million things about the U.S. government, you know, nuclear safety and things like that, that really have to be transitioned smoothly. But this is a special project that has to sort of move from, you know, January 19th to January 20th smoothly and seamlessly, and probably not something, I mean, in some ways you're going to inherit some sort of logistical structure that you're going to have to make a determination about whether it's worth improving on the margins that much if it means changing it a lot, because continuity, I would imagine, will be a really, really important goal here as well.
Well, we really do need to sit down very quickly to see what plans are in place. I mean, there's a big leap between the loading dock and the upper arm of an individual. That last mile, even that last inch of administering a vaccine is very different than making the vaccine. And we've invested a lot of money up front in making the vaccines, but yet we haven't fully invested in the money needed, the downstream infrastructure and the nursing staff and all the other supplies that are critical to make sure we could administer that vaccine that last mile and that last inch.
Yeah, I want to play something that Dr. Redfield of the CDC said about the sort of first batch and the timing on this, which I thought was interesting, and particularly talking about nursing homes, where about more than a third of COVID deaths have taken place in long-term care facilities. Take a listen.
The vaccine is going to begin to be rolled out probably by the end of the second week of December. Initially in a hierarchical way, nursing home residents and then some combination of healthcare providers and individuals at high risk for a poor outcome. And those decisions are in the process of being finalized as we speak. I do think we'll have about 40 million doses of vaccine before the end of the first year of the year. That's enough to vaccinate 20 million people, but then it will continue through January and February, and hopefully by March, we'll start to see vaccine available for the general public.
As someone who worked firsthand in this Trump administration and resigned or was fired, sort of unclear, over the mistakes they made on COVID, do you trust them right now in this crucial interstitial time to be able to deliver on what Dr. Redfield said?
Well, Chris, I really need to see the plan. You described it. There wasn't a testing plan, a testing strategy. There wasn't a response strategy. There hasn't been a strategy or a plan to scale up and manufacture PPE and N95 masks to protect our healthcare workers. And so we're really concerned that, maybe there are some gaps in the downstream distribution plan of the vaccine as well. I hope there's not, but we're ready to be able to take over that plan and augment it and make sure that every American gets the vaccine when they need to get the vaccine, and it's distributed in an equitable and efficient way.
Final question is just about the reality of now, right? The vaccine is a future thing, and it makes all of us feel good to think about a day in which we will be vaccinated and not have to deal with this. But we had 2,000 deaths today, and we still got, there's a 22-day lag between cases and deaths. So we're staring down the barrel of an unspeakable amount of pain and suffering and trauma. I mean, how are people on your task force talking about what that day one plan on suppression and mitigation and testing is going to be?
Well, I'd like to augment the previous the press conference they had today with the new appointees for the cabinet. I'd like to add to that to say science is back also. And so the president-elect team is working very hard looking at all the science. We're looking at all the ways to control this virus. We need everyone in America to help us. We can't do it alone. We need every person across our country to take this outbreak seriously. We need people to wear their mask, make sure even if they've traveled for the holiday, they take their mask, they wear it, they stay outside as much as possible for their gatherings in small groups, and they really avoid crowds and heed every bit of guidance that they can heed. We want to make sure that there are people around to get the vaccine when the vaccine is available, and we can only do that if we have the help of every American right now.
All right, Dr. Rick Bright, who serves on that COVID task force for the incoming administration. Thank you so much for talking to us tonight.